Pro actress and mom Tori Spelling and board-certified dermatologist Dr. Adam Friedman are raising awareness on eczema, a common skin condition encouraging anyone with dry, itchy, and inflamed skin caused by eczema to speak with their healthcare provider about treatment options. Welcome, Tori and Dr. Friedman. How are you guys?
Thank you for having us.
You're welcome. Tori, tell us about your personal journey with eczema and caring for your daughter, Stella, who also struggles with it.
Of course. I actually didn't get eczema till I was an adult. And it came out during one of the most stressful times in my life. I was going through my first divorce. I was also creating a new TV show that I was executive producing and starring in. And I was under so much stress. And I didn't know what was happening when it happened. My arms were just so itchy in my hands. And then I was getting flaky scales. And it was so horrific. They had to shut down production. They had to change my wardrobe. We had to hide things. And that's when I was first diagnosed with eczema. Now, my daughter, she gets a lot of great things from her mama, but it can be genetic. So my daughter Stella, who's 17 now, she does suffer from eczema as well, but it developed when she was a child, very, very young. And hers is every day she deals with it. It's on her arms, sometimes her face, her scalp. And as a mom, we've been on this journey together dealing with this. I had tried everything. I would go get every product at the pharmacy, the supermarket, anywhere I could find, trying to find something. I would bathe her in oatmeal baths because it would be so itchy and painful. And then I would ask the doctor, and they would put her on steroid cream. As a mom, first of all, they've never worked. We never found a solution for her problem or mine. But I wasn't crazy as a mom putting her on steroids. And that's why we were so excited when our dermatologist suggested we try Zoryve, because there's no steroids. I was like, oh, finally, something steroid-free. It's once a day, non-greasy, and it worked for both of us.
Oh, well, fantastic. Tori, have you worked with your healthcare provider to diagnose eczema and find treatment options that works for your daughter and you?
I have, and that's why we were ultimately able, through our healthcare provider, to find Zoryve, which is a product that works for both of us.
Okay. All right, fantastic. Dr. Friedman, what are the signs and symptoms and common triggers of eczema?
Yeah, I think we could learn so much from Tori and Stella's stories. Tori did a beautiful job describing external triggers like stress, the feeling of that itch that feels so good to scratch it, you hate to scratch. But from a clinical perspective, it could look like so many things. So that's why, to your point, partnering with a board-certified dermatologist to get the right diagnosis, because in dermatology, atypical is typical. We can see things that look like so many other conditions. Getting the right name to a face then allows you to get on the right treatment plan. Because this is such a common condition, so commonly disabling, this is why we partner with Arcutis to raise awareness, to make sure people are speaking out and not suffering in silence about their condition and getting the help that they deserve. The good news is, let's not be negative. This is a common condition, causes a lot of harm, but there's so many great options now. You heard about one of them. Zoryve, for example, Zoryve 0.15% cream or roflumilast is a once a day, which I think is meaningful. Try putting something on your body twice a day. Easy to say, not easy to do, but steroid-free. I want to spend a second on that. Steroid phobia is a real issue. Well documented, well studied. Someone will only get better if they use the product they're given. If there's fear about with that recommendation, it doesn't jive. So it's really important to have something that can be used long-term that's safe. But along those lines, safety, we have to always talk about safety, especially with new things. I'm sure your listeners always are thinking, is it safe first, then doesn't work? So with Zoryve, for example, the side effects include headache, nausea, vomiting, diarrhea, and application site pain. But these are infrequent and never stops me from prescribing to get my patients feeling better.
Okay. And it's very, very important to know these things, whatever those side effects are. Dr. Friedman, how's eczema diagnosed and what questions should you ask your healthcare provider?
Oh, great question. So there's no blood test, there's no skin biopsy that can do it. It is a clinical diagnosis. So for me, key things are: one, itch that feels really good to scratch. The clinical appearance, not always so helpful because it can look like so many things. It can be pink, it can be red, purple, off-white, brown, black. It could be broad patches. It could be little bumps. Clearly, I'm getting that point across. It can look quite diverse. But family history, as you heard from Tori, this is a genetic condition, not to mention it often runs along with asthma and seasonal allergies. So those are the key things that I ask about to help make that diagnosis and distinguish it from other things.
Tori, what do you want other people to take away from your story?
I just want to be able, I share so much in life. And I feel like this was something I never shared because I was shamed about it. And I felt like, oh, it's just eczema. I just have to suffer in silence. But then really raising my daughter and seeing how she got bullied in school so badly because of it. People will be like, what's on that girl's arms? What's wrong with her? Is it quote unquote contagious? No, it's just so much misinformation that I really found that the more we all talk about it, you see how common it truly is, that adults suffer from it, kids suffer it, moms and dads are like, oh my gosh, we want to talk about it and find a solution that works for us. And it's hard to find a solution if we're all not talking about things. So by joining the Free Me campaign, we're really speaking out about finding your confidence. And sometimes finding confidence is external, sometimes it's internal. But in this case, Stella is graduating this year. She's going to prom. She's going to go to college. And she says, oh, I can finally wear a strapless dress. I can wear a tank top. I am so confident now. So she and I really want to get that message out to people. And everyone can go to Zoryve.com to find out more information and talk to your dermatologist and see if it's the right choice for you.
And it's amazing you're sharing all this because, again, I didn't know about this, Tori. And, I was a big fan of 90210 and also your reality shows. I watched all of it.
Thank
so big fan. So great to have you. Can you share with all your fans what is happening in your busy career right now?
Of course, I am doing my podcast. I have my podcast, Misspelling. Anywhere you get your podcast, jam on, interviewing amazing guests and telling my Tori stories. And then I also, with my co-star from 90210, Jenny Garth, I have 9021 OMG and my 5 best productions ever. I am raising them, my 5 kids. We're heading into the holidays, so it's going to be a wild ride.
So you're staying busy, aren't you? It sounds like a busy mom.
I try
taking
to.
Care, yeah. Taking.
It's just going.
You just keep going and going and going. That's the only way we can do things, especially as entrepreneurs. Well, we appreciate it, Tori. Great to hear the success. And again, the best place to go is Zoryve.com. Is that correct?
Right.
All right. I thank you guys. Appreciate it.
Our pleasure.
Thank you.
All right. You're listening and watching The Neil Haley Show in just a moment.